So my topic basically expanding daycare surgery Terengganu experience from invasive to minimally invasive surgery. Why I put my slide pain-free program over there? So because this is the only platform for me for the past 13 years in order for us to promote minimally invasive surgery as well as daycare surgery in Ministry of Health Malaysia Hospital. Since 2010. Sebelum tu we have our daycare committee. We supposed to have our daycare society, Malaysian Daycare Society, but it's not happened. I think that one I reserve to Mr. Yan when they talk on the obstacle in order to promote daycare surgery in Malaysia. So this is my outline of presentation, some form of introduction. We talk a little bit on minimally invasive surgery and daycare surgery, and then after that we share our early experience, especially in laparoscopic cholecystectomy and daycare surgery. So in pain-free program, we must realize that modern surgical technique, which is mainly minimally invasive surgery, as well as daycare surgery, is one of the main component in pain-free program. So in pain-free program, we always promote the use of minimally invasive surgery. Why? Because of their advantage. I think I don't have to show you all the papers that tell us what is the advantage of minimally invasive surgery. In general, they have smaller incision, faster recovery, decreased length of stay in hospital, as well as excellent recovery, faster recovery, and early return to work. And when you look here, the benefit of pain-free program to the hospital, we try to optimize the usage of ambulatory care center, better utilization of the daycare, especially in minimally invasive surgery. When we talk about laparoscopic cholecystectomy in daycare surgery, this is, I think, very established fact for the past 10 years that daycare laparoscopic cholecystectomy is feasible and safe under daycare setup. And the advantage of daycare surgery in laparoscopic cholecystectomy, when you compare in between inpatient and outpatient, the result is almost the same. But in terms of patient satisfaction, is more superior in daycare surgery. And there is other what we call a study also to show development of laparoscopic surgery in daycare in the developed country as well as in the advanced developed country. Right? So the trend changes in practice. You see, our hospital is very crowded. We have no space. We have limited budget. So you can see the changes in practice with the advance of modern surgical technique, especially minimally invasive surgery. We try to move from inpatient to outpatient. Kalau dekat HSNZ, our OT book, kita ada chalk merah kat situ. OT book kita ada chalk merah. Why not daycare surgery? So this is why we need to change lah. Tadi ada cakap dah, number of patient admission is very high, elective as well as emergency, and we don't have enough space anymore. Surgical waiting time increasing, and for sure our budget is limited. If you look at this is my ward, surgical ward in Hospital Sultanah Nur Zahirah. You see our BOR always more than 100% for the past 4 years. Even in the female ward, in the male ward 2EF, the number is slightly less because we exclude neurosurgery patient because it's already different department. Kalau kita combine these two group of patient, still BOR 100%. And you see our katil rasmi, our official bed is basically only 30. But in female ward, our operational bed can be up to 50. kalau 51, kalau dekat 2EF, male ward in surgical department can be up to 47. Itu problem kita kan. Kita nak minta staff, kita based on apa? Operational ke kanti rasmi? Kanti rasmi kan. So that's why the problem with the staff is still the major problem lah. So kita banyak buat benda. Kita try to drink something. Kalau dekat HSNZ, our initiative in Indonesia Terengganu, we are thinking of surgical complex. We are thinking of to renovate our pusat latihan KKM to become a surgical ward. We are dreaming of Hospital Marang extension of HSNZ. This is because of overcrowded kita punya hospital sekarang ni. But till this moment, it's still a dream lah. Tapi kita still cuba, insyaAllah. So daycare service in Malaysia, after 2016, this is 2016, after we go and revisit our policy as well as our SOP on daycare surgery. So in 2016, our mantan Tan Sri DG launched our SOP as well as our policy. And why we need to promote daycare surgery? Basically, it will solve our problem. Okay? Studies have shown that daycare service in Malaysia will reduce surgical waiting time from 2 to 10 weeks. Reduction of inpatient admission by 30%. Alright? So if you look at the advanced country, dia punya rate of daycare surgery still is as high as 70 to 80%. In Malaysia, after I think 13 years, we still in average of 5 to 15% kita punya daycare surgery rate. So HSNZ, basically we started on daycare surgery in 2003. Started with medical daycare and subsequently 2007 with surgical daycare. So when with this kind of problem, kan, then we think how to move. Macam mana kita nak move? Alright? So we know laparoscopic cholecystectomy is basically it's a gold standard minimally invasive procedure for gallbladder stone. So when we talk about minimally invasive surgery, you have two components. Alright? The first one, you must have minimal access, and the second one is you must have minimal procedural trauma. Minimal access trauma as well as minimal procedural trauma. Minimal access trauma maknanya luka dia tu kecil, faster recovery, less pain, so less exposure to the visceral atmosphere that can give rise to reduced complications such as adhesion. The other factor is reduced procedural trauma. Okay, sometimes you have so-called minimally invasive surgery, access is very simple, very small, but dia punya trauma, procedural trauma tu very extensive, walaupun you call dia minimally invasive surgery. For example, endoscopic thyroidectomy. It could be a transaxillary or transaerial endoscopic thyroidectomy. Kalau Tan Sri DG cakap, you want to touch the nose, biasanya orang touch the nose macam ni kan, tapi you buat macam ni lah, touch the nose, is very difficult. So this kind of approach basically mainly for cosmetic reason. In order to get through from the axilla or transoral into the thyroid bed, the dissection is very extensive. So this kind of surgery is not suitable for daycare. So when you look at low, moderate and high, so just concentrate on the low procedural trauma. The example of the procedure is appendectomy and cholecystectomy. Appendectomy normally under emergency. It's still possible for you to do under daycare, but as a start we choose laparoscopic cholecystectomy. So in order to do this kind of laparoscopic cholecystectomy, because this is true daycare surgery, we want to do something under GA. So you must remember, in our bundle of ambulatory care service, please don't mess up our daycare with simple lump and bump under LA as far as possible lah. Okay, so because it will affect it make your daycare becoming crowded lah. Okay, so this is through daycare service in general. Through daycare service ni, daycare service under LA, under GA or under regional. LA yang complicated LA or for certain reason you have to do, then it's acceptable lah. Alright, so we look at our data. In order we want to move, we look at our elective punya data. Right? It's very crowded, decreasing because of COVID in 2020-21, but increasing back in 2022. Emergency surgery also for the past 6 years is very high. It's never decreased even with the COVID. And then if you look at the nationally, we are in the red box. But unfortunately, this is only for inpatient, elective, and emergency, outpatient, as well as they calculate the endoscopic services. They don't calculate daycare surgery. So it's very untuk hospital macam Ipoh, kira manpower kalau dia tak calculate for the daycare surgery, rugilah untuk dia orang kan. Ipoh, Terengganu, something like that. So kita tengok kita punya data. Before 2017, kita ada almost 150 to 160 cholecystectomy per year in our elective OT. No daycare surgery at all at that time. When we look at it, 67%, almost 70% done under laparoscopy and open. And then in order to move, we look at our surgeon because we don't have hepatobiliary surgeon in HSNZ. But we fortunate because we have general surgeon with special interest in hepatobiliary. If you look at their list of operation, even though they are general surgeon, they can do CBD open exploration, hepatectomy, as well as Whipple bypass surgery. So we are happy with our general surgeon, okay, in case complication happen. So we decide to move cholecystectomy from inpatient to daycare surgery. So 7 hari bulan 3 2017. So this is the tip bertuah lah. This is our first laparoscopic cholecystectomy in Hospital Sultanah Nur Zahirah. With this movement, we managed to reduce daripada 150 lebih cholecystectomy a year. As inpatient, we reduce to around 50 to 70 cases only. That's mean we managed to do laparoscopic cholecystectomy in daycare almost around 30 to 40% of our cholecystectomy. So for the past 5 years, this is not included last year 2002, we have 146 cases of laparoscopic cholecystectomy done in daycare surgery. So this is hospital punya true daycare surgery. It's around, before COVID, it's already reached around 37-41%, but it's reducing after the COVID, and then I think we managed to improve again last year. So in order to do safe surgery in daycare for laparoscopic cholecystectomy, we have to select. Selection criteria is very important. So you need to choose the criteria with 0 point lah. Okay, in terms of age, younger age group, female, okay, no history of previous cholecystectomy, cholecystitis or pancreatitis, if possible. Okay, the most common indication is basically biliary colic. You don't have previous history or infection or inflammation, just pain because of cholelithiasis. In terms of BMI, lower BMI group, no abdominal scar, no previous surgery. Okay, you still can tolerate patient with previous surgery infra-umbilical laparoscopic surgery, for example, laparoscopic appendectomy, patient with previous history of laparoscopic PTL, simple surgery, the study have shown that this kind of small infra-umbilical scar compared to the virgin abdomen is still the same. And then we exclude the sonography features. Basically, the sonography features is features of acute cholecystitis. So we don't do laparoscopic cholecystectomy in daycare surgery for acute surgical cases. So over the 147 patients, though, this is our selection criteria. You can see most of our patients is female, and then the mean age is 40 years old. So it's a 0.00% point. And then we choose ASA 1 and ASA 2. You see, ASA 3 also is there. So that means we are very close with anesthetics. So sometimes they can tolerate ASA 3 into our daycare surgery. BMI, mainly less than 30 BMI, right? In terms of indication, you can see almost 80% just biliary colic. The first 3 years we are very selective, very strict with the selection criteria. But after 2-3 years, my surgeon, they become more adventurous. They start doing patient with history of cholecystitis, with history of osteopancreatitis. But if you can see, mainly our patient is biliary colic. History of abdominal surgery, okay? 90% no previous history of surgery, only 10% with infra-umbilical simple laparoscopic surgery. So in general, this is up to 2021, okay? We successfully do laparoscopic cholecystectomy. Around 80% of our patients plan for daycare surgery. In the literature, the success rate of laparoscopic cholecystectomy in daycare surgery is around 60 to 99% in advanced center. So our rate is basically 85%. The main, another 15% is not successful because of this conversion. Sometimes you can have something yang very silent, even though you have very small infra-umbilical previous surgery. When you open up, it's very bad adhesion. And then sometimes you can have what we call silent gallbladder empyema. Clinically, nothing. Looks like very straightforward cholecystectomy, but when you open up, it's gallbladder empyema. It's basically become something like antibioma. The patient dah covered with antibiotic. So this is basically the issue why we need to convert from laparoscopic to open surgery. The most common causes is adhesion, bleeding, common bile duct injury also is there, silent gallbladder empyema, and technical issue macam tak ada gas lah, apalah kan. So the main concern here is CBD injury. Okay, so if you look at the study, the CBD injury can happen either inpatient or outpatient as daycare surgery. There is no difference in general. By right, the rate of CBD injury should be lower in daycare surgery because most of the time we will put our senior surgeon to do this kind of surgery in daycare. Unfortunately, it still happen, but it's okay. When you look at our total data, inpatient and outpatient, we have almost 283 patients. Yang inpatient tak ada CBD injury for the past 5 years. Yang berlaku dekat daycare surgery. So our rate is around 0.47%. If you look at the national survey 2019, our rate of CVD injury is around 1.1% all over the country. So it's still within the acceptable rate. So this become what we call unplanned admission. Okay, so I think our unplanned admission rate in total for Hospital Sultanah Nozairah is still within 1-2%. Ini kita baru increase kita punya KPI kurang daripada 1% kan. So it's okay. But you see, when we start this patient under daycare surgery, it's still better than inpatient, because from the daycare surgery kita hanya convert into day of surgery admission. So we save in terms of cost for 1 or 2 days admission prior to surgery. Again, remember this. Please maintain your simple surgery under LA as office procedure in order for you to move in your true daycare towards the advanced procedure. If you look at my department dekat HSNZ, this is kalau AVF, very small number yang kita buat dekat our true daycare. So we still manage simple cases in our procedure room dekat SOPD. Alright? So for AVF, almost 200 to 300 a year AVF kita buat dekat SOPD. And as well as the rest of simple procedure. Kalau kita tengok dekat SOPD last year, we did almost 327 cases under LA dekat our procedure room. So hopefully kita can upgrade our procedure room, because it's helped a lot in terms of bagi peluang kepada true daycare kepada more complicated procedure. At the end of the day, kita nak tengok this kind of achievement dekat Hospital Sultanah Nozairah. This is true daycare surgery. After the introduction of pay-free hospital program in 2015, you can see the graph is increasing. Our true daycare rate almost 39 to 40%, and is decreasing for a while because of COVID-19 lah. So in conclusion, ladies and gentlemen, minimally invasive surgery is one of the important component of daycare surgery. Okay, because of the advantage of minimally invasive surgery is very suitable for daycare surgery, and is under true daycare surgery that our Ministry of Health promote in most of the hospital. It will reduce inpatient, reduce surgical waiting time, indirectly will reduce the cost of management of the patient. Laparoscopic cholecystectomy in daycare surgery is feasible and safe. We need to start with a simple, common MRI procedure with proper selection criteria. Make sure you stick with the proper selection criteria when you want to move from invasive surgery towards minimally invasive surgery in daycare surgery. So choose the simple one. For example, laparoscopic cholecystectomy, even laparoscopic cholecystectomy. So with that, thank you for your kind attention.